Hi everybody, it's Susie. It's Monday, November 15th, and I just wanted to give a little update. This is a continuation of my video diary after my lumbar fusion at L5-S1. I've been having a really rough time with this nerve pain. I don't feel any of the surgical pain from the incision, the muscles around the incision. All that seems to be fine. I don't have, hardly any lower back pain whatsoever. The pain that I have now is it's the same kind of nerve pain I had before surgery, and into the right side of my butt, my right hip, my right thigh, outer right thigh area, like from the front half all the way around to the back half, that entire outer area of my thigh, my right calf, down into my outer toes. It's just unbelievable, the nerve pain. And I was doing great right after my surgery, and then I had the fall at 4 weeks, and just, I didn't know if it was the fall that caused all the pain or going down on the pain medication at the same time that happened. And so anyway, that was weeks ago, and I've just been kind of bearing with this pain and getting really frustrated at the same time knowing that the nerves have to heal. And it's going to take a while. But anyway, I called the doctor's office today because I just can't get the pain under control. And I was up like half the night with it last night. Just I couldn't go to sleep. And then when I finally did go to sleep, it literally woke me up in the middle of the night. So it's just this nagging, gnawing, deep kind of gnawing, burning kind of a pain. It's a little much. I don't feel any of the surgical pain. From the incision, the muscles, all that's fine. That is wonderful. Just the nerve pain. So what I talked to the doctor's office about was, when I first went on Lyrica, I talked about that in one of the earlier videos. Before surgery, I was taking gabapentin without much relief, and then switched to Lyrica for the nerve pain, and it was like a miracle drug. It worked wonders. And so when I called the surgeon's office today, I told her I was taking 150 milligrams 3 times a day, and she said, wow, she said, you can take 3 times that much. And of course, not all at once, but I told her that the surgeon, this is the surgeon's assistant, Nancy, I told her that Dr. Maniscalco, who's my surgeon, Dr. Maniscalco had told me at the last office visit, that with the Lyrica, he said, take all the Lyrica you want, but start coming off the narcotic, which is fine with me. So anyway, I called to clarify with her, with the doctor's office, if I can actually go up on that Lyrica dose, because it used to work really well. And so she said, yeah, she said, double, like take an extra dose at bedtime tonight for 300 milligrams. Try that tonight. And so I already took an extra one because I'm in so much pain. And so over the next few days, I'm going to take 1 extra and then go up from there, maybe 2 extra a day, and see how that works. I really have high hopes for the Lyrica because it made all the difference in the world when I first started taking it. And I don't know if my body's just become a little tolerant to it, or, when I asked her about that, she said, well, you might not be on a high enough dose. So, for whatever reason, it worked wonderfully before. It's not working so great now. And it's not a narcotic, and I'd much rather be taking that than the Norco, even though the Norco is a really light dose. It still has hydrocodone in it. So, I'm still having to take it like 5 times a day, and that's with a ton of Advil. So, and I had an interesting comment, and I don't have the name in front of me, but somebody commented on my profile that their surgeon had said no NSAIDs because the NSAIDs can impair the bone growth. And my surgeon did tell me that specifically about the Toradol because it worked wonderfully in the hospital, but he said I could not continue the Toradol orally because it would impair the bone healing. But he did tell me that the Advil was okay, so I am taking a lot of that. My son's creeping up on me. This is my son, Brad. So that's the latest update from today. I'm going to try going up on the Lyrica and see if that helps with the nerve pain. And I'll keep you updated. And thanks everybody for the comments and questions and just for letting me know how you're doing. It's very interesting to see how different surgeons, you know, do this and what their post-op orders are and everything. So thanks for the comments. Keep them coming, and I'll keep you tuned in. Or I'll keep you posted, rather. Take care. Bye.